Record their votes by electronic device. 5-minute vote.
Members are voting on the rule for debate for the repeal of the 2010 health care law. It would allow for 2 hours of general debate with no amendments to be considered. It's a 5-minute vote. One more 5-minute vote will follow this. And if the rule passes, 2 hours of debate ahead. And for a preview of that debate, we spoke earlier to a Capitol Hill reporter. Joining us is Mary Agnes Carey, senior correspondent at Kaiser Health News. Why are House Republicans eager to have another vote to repeal the 2010 health care law?
Well, it's no secret the House Republicans hate this law. Speaker Boehner just had a news conference today where he was talking about the law, how he feels it does damage to the economy, it's bad for patients, it's bad for the health care system. And last week he spoke about how 70 new Republicans in the House have not had the opportunity to vote on the president's health law, and they've been asking for that, and he wants to give it to them. In that briefing you mentioned he was also asked about any Republican efforts to replace the health care law. Did he mention any movement in that front? He said a couple of things. He said that he expects the House Republican Conference to talk in coming weeks and talk about what a replacement legislation would look like, and he also told a reporter, we'll let you know when we're ready to have a future vote. But he also talked about some of the legislation that Republicans have advanced before, and they certainly could advance it again. For example, legislation that would overhaul the current medical malpractice law system, allowing insurance to be sold across state lines. That's a Republican favorite. And also expanding something called a high-risk pool where people who can't get insurance in the market could go for coverage. So you could see those elements reemerge. How are Democrats responding to this effort, the latest effort to repeal all or a portion of the health care law of 2010? Kind of with a big collective yawn. I think Nancy Pelosi yesterday was saying, you know, which vote is it and how many times have they done this? And, of course, while this is the first repeal vote in this Congress, on 36 different occasions the House has voted to repeal or defund all or part of the law, and that was in the last Congress. So this has been a reoccurring theme, but I think Republicans think it works for them. It works on the campaign trail. Many Republicans have campaigned against the health care law, either new members or current members, and they feel that this is really a winner for them, especially as they look towards the 2014 elections. Well, is the law fully in effect today? No, parts of it are and parts are not. And the key thing here to think about why they would look at repeal again is two major provisions go into effect next January. That is the health insurance exchanges, these online marketplaces where people can start to purchase coverage this fall that go into effect on January the 1st of next year, and also a Medicaid expansion. And together, those two would add tens of millions of people to the healthcare system. So once those are in effect, it might be even harder for Republicans to repeal the law. Speaker Boehner in his briefing today was accompanied by a prop, that 7-foot-tall tower of red tape. What are you hearing about from folks in the healthcare industry about the law's requirements and regulations? What I'm hearing is they're having a hard time figuring it out. This is a major expansion of, for the example, talking about the insurance exchanges and Medicaid specifically. Those are two huge changes to the health care law, and employers also have some new responsibilities on benefits they have to cover, and they're just trying to get guidance from the government, and some of that has been published and more is forthcoming. And to be fair, federal officials have made, I think, all of their deadlines so far in implementing the health care law, but the thing I hear the most is people are simply confused about it, and this was what Senate Finance Committee Chairman Max Baucus was talking about a few weeks ago to Secretary Sebelius, that's Kathleen Sebelius, who runs the Department of Health and Human Services, which is overseeing the implementation. He was saying his folks back home in Montana are very confused about the health care law, and he went as far as to say he sees a train wreck coming in implementation. So there are concerns among Republicans and Democrats on the implementation process, but I think many people are just trying to figure out what it means for them. A look at the debate in the House on the health care repeal bill with Mary Agnes Carey, senior correspondent at Kaiser Health News. Thanks for joining us. Thanks for having me. And the House is voting on the rule for debate on that bill. 2 hours of general debate, no amendments. That's ahead if the rule passes. We're getting your reaction on Facebook and Twitter. This from Ginger, who says, back off, Congressman Huelskamp, back off our health care, work on sequester. $100 million have been helped by health care.
Elise says Sebelius asked the healthcare industry for donations to prop up Obamacare. Again on Facebook, facebook.com/cspan, asking you whether you support or oppose the repeal of the 2010 health care law. Elsewhere on Capitol Hill today, the Health Education and Labor Committee in the Senate approved the nomination of Tom Perez. It goes to the Senate floor next. The Senate itself just confirmed the nomination of MIT physics professor Ernest Moniz for Energy Secretary. That was a unanimous vote, 97 to nothing. On the NLRB nominees, the nominees appeared today before the Education and Labor Committee in the Senate, and this is the Third Circuit Court of Appeals in Philadelphia this afternoon ruled that President Obama exceeded his power in making those recess appointments to the National Labor Relations Board. The committee heard from the nominees earlier today. You will see that later in our program schedule.
Mr. Speaker, I ask unanimous consent to speak out of order.
Without objection, the gentleman is recognized.
Thank you, Mr. Speaker. As many of you know, this is National Police Week. Law enforcement officers throughout our country are gathered here in our nation's capital to remember those that have fallen in the line of duty. As a former sheriff and police officer, I couldn't be more proud to be part of this family. Unfortunately, last year, we lost 120 brave men and women, and this year we've already lost 41. When tragedy strikes, as it recently did in Boston, we're reminded of these officers' selfless courage. Yet we often forget that these men and women are at risk every time they report for duty. Every time they kiss a loved one goodbye, they never know if it's going to be for the last time. And day in, day out, they put their lives on the line to keep us, our communities, our towns, and our cities safe. For this, we owe them a debt of gratitude. And so in honor of these law enforcement officers who made the ultimate sacrifice to keep us safe, please, could we have a moment of silence?
Members will rise, and the House will observe a moment of silence. Without objection, 5-minute voting will continue. Pursuant to Clause 8 of Rule 20, the unfinished business is the question on agreeing to the Speaker's approval of the Journal, on which the yeas and nays were ordered. The question is on agreeing to the Speaker's approval of the Journal. Members will record their votes by electronic device. This is a 5-minute vote.
Last vote in the series, it's on the Journal, the official written record of the previous day's activities. Just moments ago, they approved the rules for debate for the bill that would repeal the 2010 health care law. 2 hours of general debate coming up on the House floor. In a related story, a couple of House Republicans have introduced separate bills aimed at scaling back the IRS involvement with the implementation of the law. Randy Forbes and Tom Price of Virginia writes the Hill that says their bills are needed in the wake of the IRS's confirmation that it applied extra scrutiny to conservative groups seeking tax-exempt status. They write that Representative Forbes' bill would prevent the IRS from hiring what many expect to be thousands of new IRS agents tasked with implementing the law. The Ways and Means Committee in the House will hear about the IRS targeting of select conservative groups tomorrow, the hearing getting underway at 9 o'clock Eastern, and will include the Inspector General of Treasury, and will also include the acting IRS Director, Stephen Miller, who resigned yesterday but is scheduled and has said he will appear tomorrow before the Ways and Means Committee. We'll have live coverage on C-SPAN 3 at 9 a.m. Eastern tomorrow.
On this vote, the yeas are 277, the nays are 132. With one answering present, the journal stands approved. For what purpose does the gentleman from Florida seek recognition?
Mr. Speaker, I ask unanimous consent to withdraw my name as a co-sponsor to House Resolution 36.
Without objection, so ordered.
Thank you.
For what purpose does the gentlewoman from Tennessee, Mrs. Blackburn, seek recognition?
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and to include extraneous material on H.R. 45.
Without objection. For what purpose does the gentlewoman from Tennessee seek recognition?
Mr. Speaker, I move to begin the debate on H.R. 45.
The clerk will report the title of the bill.
H.R. 45, a bill to repeal the Patient Protection and Affordable Care Act and healthcare-related provisions in the Health Care and Education Reconciliation Act of 2010.
Pursuant to House Resolution 215, the amendment printed in House Report 113-59 is considered adopted, and the bill as amended is considered read. Debate shall not exceed 2 hours, equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Education and the Workforce, the Chair and Ranking Minority Member of the Committee on Energy and Commerce, and the Chair and the Ranking Minority Member of the Committee on Ways and Means. The gentlewoman from Tennessee, Mrs. Blackburn, and the gentleman from California, Mr. Waxman, will control 20 minutes each. The gentlewoman from Tennessee is recognized.
Thank you, Mr. Chairman. I yield myself such time as I may consume. You know, it is just absolutely amazing that we are once again here on the floor to repeal Obamacare. But it is a necessary step that we find that we have to do. It is so interesting being out in my district, whether I am talking to state elected officials or county elected officials, or talking to those who are employers in our district, those who are job creators. Repeatedly, we hear from them. This is a bill that turned into a law that is too expensive to afford. One of the reasons, and I would point this out, this is a copy of the law as published. What it has turned into is 13,000 pages of regulation. Indeed, I wanted to bring that tower of red tape here to the floor today. It is 7 feet tall and growing. 7 feet tall and growing. It was too big to be allowed on the House floor. It is amazing that much regulation that has come from this 2,700-page bill. And now we find out from the Washington Post and the New York Times that Secretary Sebelius has had conversations with some companies and organizations asking them to help fund getting this started. Why is this happening? Because it was to be 3 years ago, we were told it would be an $800 billion bill. And guess what? When we went to Budget Committee this year, $2.6 trillion is the estimated cost of this bill. So insurance, more expensive. It was to save households $2,500 a year, but instead they're already paying $3,000 more, and the survey that Chairman Murphy ran for us at Energy and Commerce Committee shows that the cost will go up anywhere up to about 400%, depending on who you are, what group you're in. That's what you're going to see your insurance costs go up. We hear from physicians, harder to get in to see a physician? Yes, it is. Our goal should be about how do we preserve access to affordable health care for all Americans. Instead, what my friends across the aisle have done is to focus on how do you centralize health care, run up the cost, and decrease access. That is the reason that we are here on the floor today. I reserve the balance of my time.
Gentlewoman reserves. Gentleman from California is recognized.
Mr. Speaker, I yield myself 2 minutes.
Gentleman is recognized.
I rise today in opposition to the Patients' Rights Repeal Act, because what the Republicans will do is take away all the benefits the American people are already seeing under this law, and they will stop the full implementation of it to provide millions of people with health insurance opportunities. Our Republican colleagues say they want to provide access to health care. They want to do something about people with pre-existing conditions. They say they care about stopping discriminatory practices. They want to lower the deficit. They want to stop rising health care costs. This bill, the Affordable Care Act, is the one piece of legislation that takes major steps on these issues. The Republicans offer nothing but opposition over and over again. This is the 37th time the House will vote to repeal the Patients' Rights Bill. From the very beginning, the Republicans opposed it. They said it will kill jobs, and they were wrong. They said the law would drive up health care costs through the roof. They were wrong. We're seeing the slowest growth in health care spending in decades. They've ignored the significant benefits that are helping tens of millions of people, such as 3 million young adults who have coverage through their parents' plans, 6 million seniors who have saved over $6 billion on their prescription drugs, 13 million Americans who have received over $1 billion in rebates from their insurers, over 100 million Americans who have access to free preventive care, who no longer face lifetime limits on their coverage. And the Congressional Budget Office still confirms that the law cuts the deficit by $100 billion in the first decade and more than $1 trillion in the second. The Republican Patients' Rights Repeal Act undoes all of these benefits. They add to the deficit, and they send us back to the days when insurance companies were in charge. Costs were skyrocketing, and tens of millions either had no coverage, especially if they had pre-existing conditions, or coverage they could depend on. I urge my colleagues to vote no on this legislation and reserve the balance of our time.
Gentleman reserves. Gentlewoman from Tennessee is recognized.
Thank you, Mr. Chairman. At this time, I yield to the chairman of the Health Care Subcommittee, Mr. Pitts. 1 minute.
Gentleman from Pennsylvania is recognized for 1 minute.
Thank you, Mr. Speaker. On Monday, in 2 separate forums, I met with members of the Lancaster County and the Chester County Chambers of Commerce, representing dozens of businesses and municipalities across my district, about the implementation of the Affordable Care Act. Every single one of them had grave concerns with the law. They're confused and deeply concerned about how it will affect their ability to provide care and jobs. We're only a few months away from implementation of the employer mandate, and there are many unanswered questions. Each employer I talked to had pressing questions, but time and again I had to tell them that I didn't have an answer because HHS, the IRS, or the Department of Labor hadn't issued rules or guidance yet. This uncertainty is leaving them paralyzed, holding off on hiring and wondering whether they will be able to afford coverage for their employees. It's not just businesses that are hurting. I heard from school districts operating on tight budgets who said they have no choice but to outsource loyal hourly employees like cafeteria workers, special ed aides, going to part-time work. Workers are losing their jobs, losing work hours, losing benefits to this bureaucratic nightmare. Let's stop the damage. Let's repeal the train wreck before it occurs. I yield back.
Gentlewoman reserves. Gentleman from California is recognized.
Mr. Speaker, I ask unanimous consent that our time from the Energy and Commerce Committee be controlled by our subcommittee ranking member, Congressman Frank Pallone from the state of New Jersey.
Without objection, the gentleman from New Jersey will control the time.
Mr. Speaker, I yield myself 2 minutes.
Gentleman is recognized for 2 minutes.
Mr. Speaker, I rise today in opposition to the Patients' Rights Repeal Act. I greatly respect my colleagues on the other side from Tennessee and from Pennsylvania, but I have to say, they are simply obstructionists. And this is what we get from the GOP on a daily basis. Nothing happens here in the House of Representatives. We know there's a problem. Historically, there's been a problem with health care and a lot of people not having insurance or having discriminatory practices or not being able to get on their parents' insurance policy. And so we as Democrats came up with a solution. and that solution is working. We have kids now, almost 6 or 7 million kids that are now on their parents' policies. We have a situation where we're plugging up the donut hole in Medicare for Part D prescription drugs for seniors. We have all kinds of preventative care that's out there relative to women's health, and the list goes on and on. These things are happening, and beginning next year, most Americans will have health insurance. And what do I hear from the other side? They don't want solutions. You know, I'll have to be honest with you, to my colleagues. If you really care, why don't you make some suggestions, and maybe we can work together. Anything can be improved. I don't say that anything can't be improved, but no. They come on the floor, and what do they want to do? Just repeal it, okay? Which is not a solution, which basically would eliminate all the progress that we've made in terms of health care. And yes, costs are not going up as much. And yes, people are getting rebates if their insurance companies charge them too much. All these things are happening because of the Affordable Care Act. But all I hear from you is, no, obstructionism. No, we have to repeal this because this is such a terrible thing. Yeah, bringing in all these abstractions about what the Secretary of Health and Human Services is doing. This is not what you're elected to do. You're not elected to come down here and just repeal things and say how bad everything is. You're supposed to come up with solutions, and I never hear it from the other side of the aisle. I simply do not hear it, which is why I get very upset 37th time, 38th time we're going to vote on the same thing, which is repeal of the Affordable Health Care. It really is disgraceful.
Time has expired. Gentleman reserves. Gentlewoman from Tennessee is recognized.
Yes, I yield myself 15 seconds to respond. We believe, Mr. Chairman, that solutions, we trust our constituents and the American people. We don't need government control of this. Certainly, we don't need the IRS policing our private health care information. There's nothing affordable about the Affordable Care Act. That's why we're concerned. At this point, I want to yield 1 minute to the chairman of our conference, Ms. McMorris Rodgers from Washington.
Gentlewoman from Washington is recognized for 1 minute.
When President Obama's health care proposal became law, he told us that it would lower cost, improve quality, cover everyone with pre-existing conditions, and ensure that those under 26 would remain insured. But today, when we pull back the curtain, the American people see that this law has just made things worse. The President promised that premiums would go down. In fact, he said families would see an average decrease in premiums by $2,500. Instead, the average family has seen premiums go up by over $3,000. And they're hitting young people hard, some facing increases up to 200% and many losing insurance. The President promised that those with pre-existing health conditions would be covered. Unfortunately, just over 100,000 people enrolled in the program before he declared it ran out of money. The President promised that his plan would lead to all Americans having health insurance, but CBO already estimates that 30 million people will still be uninsured even after the law is fully implemented. We need to replace this policy with one that helps Americans.
Gentlewoman reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to our Chairman Emeritus from Michigan, Mr. Dingell.
Gentleman from Michigan is recognized for 1 minute.
Speaker, I ask you to suspend my remarks.
Without objection, so ordered.
This is a prodigious waste of the time of the House and working on a bad piece of legislation. I rise today in strong opposition to the Patients' Rights Repeal Act. My Republican colleagues are up for the 37th time with this nonsense, and they are fully determined to take away all of the rights that we have given under the Affordable Care Act to the people of the United States. People are going to go back in the donut hole, courtesy of the Republicans. No longer will people be protected against being excluded from insurance because of the pre-existing conditions. And it is going to be possible now for insurance companies to kick people off of insurance companies because they get sick while they have a policy. Kids are not going to go on their parents' policies after they're 26 if we pass this nonsensical legislation. Einstein said that expecting a different result from things done over and over again is proof of insanity. Well, this is insanity, but worse than that, it's a waste of time of the people in the Congress and the money of the United States citizens who pay our wages. This is a bad proposal. Vote it down.
Gentleman reserves the balance. Gentlewoman from Tennessee is recognized.
Thank you. At this time, I yield 1 minute to the chairman of the Oversight and Investigation Subcommittee at Energy and Commerce, Mr. Murphy.
Gentleman from Pennsylvania is recognized for 1 minute.
Thank you. The health care bill indeed has some good things in it. No lifetime caps, kids on their parents' policy, people can't be denied, and some prevention. But good intentions do not guarantee good results. Because the guarantee of this bill, we were told it would lower costs, and we're now in a position where it may cost families more and they won't be able to cover it. On top of $835 billion in taxes, our Energy and Commerce Committee did a study, and getting responses from 17 insurance companies, they reported that there'll be a 96% increase in cost for those getting a new policy, 73% for those keeping, and some will be as high as 413%. Some will see lower costs, but most Americans will see some increase in the health care costs. That's the reason why we need to repeal this and get back to really reforming health care, keeping the good parts, but Americans cannot afford this, and what is not affordable is not accessible care. I yield back.
Gentleman yields back. Gentlewoman reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from New York, Mr. Engel.
Gentleman from New York is recognized for 1 minute.
Well, here we are again, voting for the 37th time to repeal the Affordable Care Act, a law the Supreme Court has deemed constitutional. This is nothing more than a feel-good moment for new members of the GOP who didn't get a vote on the repeal in the last Congress. If the new standard for scheduling votes is to provide wish fulfillment for members of Congress, then I have a few requests. If we're going to vote almost 40 times to repeal health care coverage for millions of Americans, I'd like to have the chance to vote against the Defense of Marriage Act 40 more times. I had the pleasure to vote against it in 1996. I'm sure there is a new generation of members who would like to vote against it, and I would like to do it again. Furthermore, I regret being a teenager when the Civil Rights Act was voted on. I'd like a chance to lend my support to that landmark law. To be able to cast a vote to go to war against Nazi Germany would be very satisfying to me, and I've contributed to Social Security my whole life. And since my father was not a member of Congress in 1932, I would like to vote on his behalf to support the creation of Social Security. I was a student of history in my youth, and I feel very strongly that the Compromise of 1850 was the point of no return leading to the Civil War. I'd like a chance to vote against it. And I ask that the Republican leadership add all of these to the agenda in the weeks to come.
Gentleman's time has expired.
Can I ask for 30 more seconds?
Yield the gentleman another 30 seconds.
Gentleman is recognized for 30 more seconds.
So clearly we have plenty of time available for wish fulfillment rather than substantive measures such as the economy, immigration reform, and putting people back to work. So I'd like an opportunity to vote again on many different things as well. I yield back the remainder of my time.
Gentleman yields back. Gentleman from New Jersey reserves. Gentlewoman from Tennessee is recognized.
Thank you. At this time, I would like to yield 1 minute to a member of the Energy and Commerce Committee, Dr. Gingrey from Georgia.
Gentleman from Georgia is recognized for 1 minute.
Mr. Speaker, today we are once again voting to totally repeal the Patient Protection and Affordable Care Act, Obamacare. Now, the most senior members of the Energy and Commerce Committee from the Democratic side stand up here and say this is the 37th time that we have voted for total repeal. No, it's the 3rd time. But we are voting for total repeal for a 3rd time because Republicans and Democrats, 65%, young and old, of the people across this country demand total repeal. They know that they don't want the government taking over 1/6 of our economy and Washington bureaucrats imposing a massive tax increase on middle-class Americans and small business owners. As the government becomes more involved in health care, doctors and patients become further removed, more involved, further removed from their own health care decisions, and this will result in a more expensive and a more dysfunctional system. Patients should have more control of their medical decisions, and reform should be driven at the state level rather than rushing through legislation that we have to read to find out what's in it. And if the gentlelady will yield me an additional 30 seconds, 15, thank you. And now, Mr. Speaker, small business women and men have to read a stack of rules and regulations 7 feet high to find out that truly the devil is in the details. As both a physician and taxpayer, fully repealing Obamacare is my top priority, and I'm proud that we will soon take yet another step toward this critically important goal. I yield back.
Gentlewoman reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from Texas, Mr. Green.
Gentleman from Texas is recognized for 1 minute.
Thank you. Mr. Speaker, I rise in opposition to the Patients' Bill of Rights Repeal Act. Here we go again, and my colleague from Georgia knows it. 37 times, the Republicans counting today, that the Republican majority has tried to repeal the Affordable Care Act, a law that was upheld by the Supreme Court, one that will help not only millions of uninsured, but everyone with health insurance, because the Accountable Care Act improves coverage. Repeal means insurance companies can once again deny coverage for pre-existing conditions. It can mean college-age dependent children will be kicked off their parents' insurance. Medicare beneficiaries will lose vital preventative screenings. And the insurance company practices of the past, which frustrated the insured and drained their savings, will be allowed to return. The Affordable Care Act means more than 80% of the premium dollars are spent on health care. That was in the Affordable Care Act. The law prevents insurance companies from providing their executives extraordinary perks while failing to provide health care to their customers. But this will never happen again. A repeal of the Affordable Care Act will not be successful. It wasn't successful the first 36 times. It won't today.
Gentleman's time has expired.
Because the American people need it.
Gentleman from New Jersey reserves. Gentlewoman from Tennessee is recognized.
Mr. Chairman, thank you. At this time, I yield 1 minute to the gentleman from Florida, Mr. Bilirakis, a member of the committee.
The gentleman from Florida is recognized for 1 minute.
Thank you, Mr. Speaker. I appreciate it. I support repealing the misnamed Affordable Care Act because it's a law that Americans cannot afford. A recent report from the Energy and Commerce Committee shows that health insurance premiums for small businesses could rise by an astonishing 400%. For my home state of Florida, the report notes that individuals enrolled in some current plans could see increases of over 100%. In the small group market, we expect to see increases as well. This law is not affordable for individuals or small businesses. The health law tries to hide these new costs through subsidies and tax credits paid for through new taxes and cuts to Medicare. We need to repeal this job-crushing, premium-rising, government-expanding law. I'm proud to be a co-sponsor of H.R. 45 and to support repealing this unaffordable act. I yield back, Mr. Speaker. Thank you.
Gentleman yields back. Gentlewoman reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, I just want to set the record straight that there's no government takeover in the ACA, contrary to what my Republican colleagues are saying. The ACA is built on expanding private sector coverage by improving options in the individual market and encouraging employers to provide coverage. The claim that the ACA is a government takeover is totally unfounded. A system built on private insurance, private doctors, and private hospitals is not a government takeover. I yield now 1 minute to my colleague from California, Ms. Capps.
Gentlewoman from California is recognized for 1 minute.
I thank my colleague for yielding. Mr. Speaker, I rise today yet again in opposition to the Patients' Rights Repeal Act. 3 years, 37 repeal attempts later, the majority is still playing politics with the health care of real people. Thanks to Obamacare, 27 million American women now have access to preventive health screenings and health care without cost sharing. They can receive cancer screenings, annual wellness physicals, and contraceptions without extra cost. Seniors in my district saved an average of $600 last year on prescriptions. As we close the donut hole, the savings will be even greater. And families no longer have to worry that their children will be denied insurance due to a pre-existing condition. Repeal would take these benefits and protections, raising costs for families. It would return us to a broken system, all the while increasing the deficit. It's time to move on. Let's spend our time working on new solutions instead of repeatedly placing partisanship over politics, over progress, and I urge the defeat of this bill.
Gentleman reserves. The gentlewoman from Tennessee is recognized.
Thank you, Mr. Chairman. At this time, I yield 1 minute to our Chairman Emeritus at the Energy and Commerce Committee, Mr. Barton of Texas.
Gentleman from Texas is recognized for 1 minute.
Advise and extend.
Without objections ordered.
You've seen the TV commercial about oil filters where somebody brings their car in and they haven't had their oil changed, and the guy says, well, they could have paid me before by changing the oil filter, or they can pay me later when they bring the car in. Well, that's where we're here today. We're going to repeal this act. We can repeal it today or we can repeal it later, but it's going to be repealed. My friends on the minority side talk about all the good things of it and act like there's no government intervention. There's just a government mandate that you have to have insurance. There's a government mandate that employers have to provide it. There's a government mandate on what has to be included in that coverage. There's a government price control on the price of the premiums. And of course there's a mandate that everybody in the country has to have insurance, and the IRS can enforce that as a penalty if in fact you choose not to participate in that mandated program. Other than that, there's no government involvement in this law. So my good friends, I would say vote with us to repeal it now so we don't have to come back later next year, the year after, when health care is in a shambles, and we'll repeal it then.
The time has expired. Gentlewoman reserves her time. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from Pennsylvania, Mr. Doyle.
Mr. Speaker, I rise today in opposition to the Patients' Rights Repeal Act. Today is actually an embarrassment. Today, for the 37th time, we vote to repeal the Affordable Care Act, a messaging vote that is surely dead on arrival when it reaches the Senate. I would say to my good friend from Texas, you can repeal it in this House 37 more times, and it's going to be just as dead when it gets over to the Senate. This is a waste of our time. A CBS analysis last year said Congress spent 80 hours, 2 full weeks of work on repeal votes that cost the taxpayers $48 million. Bryce Covert and Adam Peck of Think Progress estimated that since then, we've spent an additional $6 million, bringing the total to $55 million on 37 symbolic votes to repeal the Affordable Care Act and waste our time here on the floor of the Congress. Just think what we could have done with $55 million. We could make sure college students have access to federal work-study grants. We could keep low-income kids in preschool. Quit wasting the taxpayers' money and this Congress's time. You should be ashamed of yourself.
Gentleman reserves. The chair will remind all persons in the gallery that they are here as guests of the House and that any manifestation of approval or disapproval of proceedings or other audible conversation is in violation of the rules of the House. The gentlewoman from Tennessee is recognized.
Thank you, Mr. Chairman. At this time, I yield 1 minute to one of our freshmen, the gentleman from Georgia, Mr. Collins.
Gentleman from Georgia is recognized for 1 minute.
Thank you, Mr. Speaker. I rise in strong support of H.R. 45, and I thank our leadership for bringing this legislation to the floor. Because contrary to popular opinions, patients' rights were the ones in jeopardy a few years ago, and that's what we're restoring. Architects of Obamacare have said it's so complicated, and if it isn't done right the first time, it will just simply get worse. By done right, they really mean that the administration simply has to write enough of the right regulations. Nearly 20,000 pages of Obamacare-related regulations are already on the books, including 828 pages that were issued in a single day earlier this year. This tidal wave of regulations should be no surprise to anyone who bothered to read the health care bill before they voted on it. With the truth of our economic condition and the real contents of the health care bill beginning to sink in, I don't believe there's a better time to consider repealing Obamacare than right now. I strongly support this bill and yield back the balance of my time.
Gentleman yields back. Gentlewoman reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to the gentlewoman from Illinois, Ms. Schakowsky.
The gentlewoman is recognized from Illinois. Gentlewoman from Illinois is recognized.
Mr. Speaker, I rise today in opposition to the Patient Rights Repeal Act. Rather than more rhetoric, I challenge my Republican colleagues to explain to the American people why we should take away the benefits and protections that Obamacare already provides and will provide. Explain to the 125,000 young adults in Illinois that they have to get off their parents' policies, even if they're sick. And explain to the 134,000 seniors in Illinois who have saved over $235 million on their prescription drugs why we need them to pay more for their drugs. And explain to the 1.4 million Illinoisans who will finally have the opportunity to obtain quality, dependable health insurance coverage. Sorry, politics trumps expanding their access to health services. I urge my colleagues to take a stand for the health of the American public, vote no to the Patients' Rights Repeal Act. And I yield back.
Gentlewoman yields back. Gentleman reserves his time. The gentlewoman from Tennessee is recognized.
Thank you. At this time, I yield 1 minute to another of our freshmen, Mr. Holding from North Carolina.
Gentleman from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, Obamacare is bad policy for patients, for doctors, for seniors, for young folks, for small businesses, for medical technology and pharmaceutical companies, and for families. Mr. Speaker, folks in my district tell me time and time again that they are most concerned about the increasing cost of health care, and Obamacare does nothing to address those concerns. In fact, recent reports have suggested exactly the opposite. Mr. Speaker, I think Senator Baucus was dead on when he said that he sees a huge train wreck coming down the line in regards to Obamacare. Obamacare was shuffled through Congress with backroom deals and false promises. American families deserve better. They deserve to make their own choices about health care, not the government. That is why I'm proud to rise today and join my colleagues in repealing this misguided and misnamed law. Thank you, Mr. Speaker, and I yield back.
Gentleman yields back. Gentlewoman reserves. Gentleman from New Jersey is recognized.
Thank you, Mr. Speaker. I yield 3 minutes now to our Democratic whip, Mr. Hoyer from Maryland.
Gentleman from Maryland is recognized for 3 minutes.
Ask unanimous consent to revise and extend.
Without objection, so ordered.
Mr. Speaker, apparently the Republicans are opposed to Obamacare. I know that comes as a shock to America, so we need to tell them one more time, or 37 times, or maybe a 38th or a 39th or a 40th or a 100th time. I don't know how many times we have to replay the election. There was an election in which this was one of the principal issues. And the proponent of health care for all Americans was elected by most Americans. Mr. Speaker, this vote, as we all know, is a waste of our time. It is, however, a political exercise. This will be the 37th vote to repeal health care reform since the Republicans took control of the House. It's exactly the same as the bill that we considered in July. That partisan bill was dead on arrival in the Senate, just as this one will be. And everybody knows it. In fact, the New York Times reported that since 2011, Republicans have spent no less than 15% of their time on the House floor. That's since 2011. 15% of their time on this House floor trying to repeal health care for all Americans. When President Obama was reelected after campaigning on the Affordable Care Act as a major first-term achievement, with the unanimous opposition of our Republican colleagues, and after the Supreme Court said, yes, this is a constitutional exercise of the Congress's authority, Speaker Boehner said, quote, Obamacare is the law of the land. I'd hoped that would be the end of wasted time and $52.4 million in taxpayer money on legislation to nowhere that would strip away benefits from millions and millions of Americans. Sadly, however, this vote is more of the same. It would increase out-of-pocket costs on preventive services for 105 million Americans, including 34 million seniors on Medicare and 71 million Americans covered under private plans. It would allow insurance companies to reimpose arbitrary lifetime limits on coverage for more than 100 million people. It would allow insurance companies once again to discriminate against and deny care to as many as 17 million children with pre-existing conditions. Now, Cantor Care tried to reverse that and had to be pulled from this floor because even a Republican-sponsored attempt at dealing with pre-existing conditions was rejected by our Republican colleagues. Mr. Speaker, the clock will not be turned back. May I have 30 additional seconds?
You yield the whip an additional 30 seconds, Mr.
Thank
Speaker.
you, gentlemen.
Gentleman is recognized for additional 30 seconds.
Mr. Speaker, the clock will not be turned back. Obamacare is the law of the land, not my words, Speaker Boehner's. You say this vote is necessary so that freshman members have a chance to get on record on a major issue. If they haven't gotten on record now, they're not going to get on record. If that is the standard for getting a vote on the floor, then let us have a vote on replacing the sequester, which you have denied freshmen the chance to vote on all year. That is what we ought to be spending our time on, getting our country on a sound fiscal path, creating jobs and growing our economy. No, we tread water.
Gentleman's
we
time has
waste
expired.
time. We continue to debate for the 37th time the repeal of health care for all Americans. I yield back to the balance.
Gentleman reserves. The gentlewoman from Tennessee is recognized.
Thank you. At this time, I would yield 1 minute to the gentleman from South Carolina, Mr. Rice.
Gentleman from South Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. This may be the 37th time that the House has taken up the repeal of Obamacare, but this is my first time. And I and the constituents that sent me here want my vote recorded to repeal this poorly crafted, job-killing law. Last week, colleges in my district graduated more than 2,000 students eager to enter our workforce. These week-old college graduates in my district will be met with real-life challenges immediately thanks to the President's health care law. Over 50% of recent college graduates are unemployed. 5 years after the recession, national unemployment remains unacceptably high. 70% of small businesses cite the Affordable Care Act as a reason not to hire. Businesses large and small are considering cutting their workforce and reducing hours to avoid the requirements of the Affordable Care Act in January. Working families in America are hurting, and the Affordable Care Act is adding to their pain. The CBO estimates that 30% of employers will stop offering...
Gentleman's time has expired.
Can I have 30 more seconds?
Gentlewoman reserves her time. Gentleman from Pennsylvania or from New Jersey is recognized.
Mr. Speaker, could I ask how much time remains on each side?
Gentleman from New Jersey has 5 3/4 minutes. Gentlewoman from Tennessee has 7.5 minutes remaining.
Thank you, Mr. Speaker. I
Gentleman is
yield 1 minute at this time to the gentlewoman from Florida, Ms. Castor.
Gentlewoman from Florida is recognized for 1 minute.
Mr. Speaker, the Affordable Care Act is working for families and small businesses all across America. Did you know that the Affordable Care Act provides tax credits to small businesses that offer health insurance to their employees, and that over 360,000 small businesses have taken advantage of those tax credits so far, and millions more remain eligible? Speaking of young people, in the state of Florida alone, over 224,000 young people have been able to have health insurance because they've now been able to stay on their parents' policies. 1.3 million Floridians have received $124 million in rebates from insurance companies, an average of $168 per family, because of important consumer protections provisions in the law that say insurance companies can't charge families too much. Medicare is stronger, the donut hole is closing, and the Affordable Care Act is a godsend to so many families who had pre-existing conditions, whether it's cancer or diabetes or some other chronic condition. To my Republican colleagues, let's come together to work on the economy and creating jobs rather than another deja vu of repealing health care and wasting time. I urge everyone to vote no on the Patients' Rights Repeal Act.
Gentleman reserves. Gentlewoman from Tennessee is recognized.
Thank you, Mr. Chairman. You know, we are working on jobs. I'll take 15 seconds to respond to a couple of things. And one of the items that concerns us is that, according to CBO, implementation of the Obamacare bill with its 13,000 pages, 7-foot-tall tower of red tape would cost this economy 800,000 jobs. We also know that it's gone to being a $2.6 trillion program. At this time, I yield 1 minute to Mr. Pittenger from North Carolina.
Gentleman from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, I rise to join a chorus of people who recognize the ineffectiveness of the Affordable Care Act, which, frankly, Mr. Speaker, is not even affordable. The CBO also said that there's $1.8 trillion now added to the cost of Obamacare. We've seen the impact of physicians Physicians, particularly those with specialties, don't want to continue in their practice. People in medical school, they don't want to continue. People in undergraduate, they don't want to go to med school. There's a dearth, Mr. Speaker, of availability in the future for physicians. We've seen premiums skyrocket. In North Carolina alone, the premiums have increased 284%. We've seen the impact of 7 million people now who cannot take their own personal health insurance that they were promised. We've seen a risk pool that no longer has funding available. Mr. Speaker, the American people deserve better, and we're going to work hard to make sure that we have a competitive health care program that will deliver true health provision for the American people. Thank you.
Gentleman's time has expired. Gentlewoman reserves. The gentleman from New Jersey is recognized.
I yield now 1 minute to the gentleman from New York, Mr. Tonka.
Gentleman from New York is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in opposition to the Patients' Rights Repeal Act. That's right, America, the repeal of patients' rights brought to you by the Republican majority of the House. It's the 37th vote to repeal Obamacare. While far from perfect, the Affordable Care Act was a serious attempt to solve a serious problem. By contrast, the legislation we are considering today is not serious, and the only problem it portends to solve is offering new members of this body the opportunity to vote on a bill that isn't going anywhere. I assure you there is no lack of real problems for this body to address. As of March, the unemployment rate for most of my